Of course it's emotional. Was it emotional for you also, Zev?
It was. It was. I'm just tearing up now. Actually, think about it. Twice a year, she'll send me a big fruit basket or a candy bar or a plant. And I said no, and she says you can't. She refuses to listen to me. She says I'm her brother now.
Some people give money. Some people give time. And then there are people who look at the world and say, I can literally save a life. Why wouldn't I? Today's guest is Rabbi Dr. Zev Gershon, Esquire, a rare combination of MD, attorney and rabbi, and someone who has spent decades in the real world of suffering and repair, serving now as a medical malpractice lawyer, where compassion has to be practical and truth has to be precise. But what brought Zev onto this show isn't his titles. It's this. He voluntarily donated a kidney long before it became common and long before Israel became known as the world leader in living kidney transplants. In this conversation, you'll hear why most people who reach out to him are told, you don't have a case, and why that itself can be a form of giving. How he thinks about justice without feeding resentment, what it's like to meet the recipient of a kidney you donated to them, and the simple principle that guides his giving. Someone else benefits without you losing. This is You Are What You Give. Let's begin. Rabbi Dr. Zev Gershon, Esquire. All of those titles, but really the most important title, I think, is that you're such a good friend to my father, to my family, and it's great to have you on the program. Normally I get to interview all kinds of people that I may know a little bit better, maybe not so well, but having someone who lives in my parents' neighborhood is really a special opportunity, and especially on the topic that we're going to speak about. So Zev, thank you for joining us today.
Thank you for having me. I'm honored to be on your podcast.
Well, thank you, Zev. Zev, there's so much to talk about. I want to start with all of these titles. Rabbi, doctor, you're a lawyer, and there's a lot going on there. Can you tell me what came first? Doctor, lawyer, rabbi, how does this progression work?
So after college, I went to medical school to please my parents, of course. And I found, at least my experience in medical school was more memorization than thinking. I did have interviews set up at 6 hospitals for internal medicine residency and chose at the last minute not to do that. And a friend of a friend directed me to a lawyer because I was looking to combine medicine with something else. And the lawyer was a malpractice lawyer. And he said, hey, how about go to law school? And I liked the reasoning and that. And so I went to law school at night and I worked for a law firm during the day as what they billed me as a forensic consultant. And I helped them with their medical malpractice cases, actually as a defense firm. And after I graduated, coincidentally, that firm went under. And so I looked around for a job and I found a job with a plaintiff's medical malpractice firm. And that's what I've been doing ever since. And I guess maybe 10 years ago, to answer your essay, I decided to go for additional knowledge and study and became a rabbi. Not that I have a congregation or anything, but I did some learning and knowledge that allowed me to have that title.
So, Zev, you just kind of like flew through decades of your history nonchalantly. Oh, I did a little of this and I did a little of that. Zev, you're, from what I know, you're a pretty committed and dedicated person. I don't think any of those things were small or trivial. And I kind of wonder, first of all, I mentioned my father previously. You and my father, you like to have maybe a couple jokes here and there and have a good time. And it's pretty well known, I think, that doctors and lawyers both have lots of jokes about one another. And I don't know, does this give you like joke immunity because you're both, or does it make you more exposed because you're both?
Well, I haven't had such an issue. I am good friends with your dad, as you know. And sometimes when we have our banter back and forth, he will say, so, doctor, when he wants to make a mistake. But sometimes he'll say, as an attorney, you know, and I'll respond, as an attorney, you know, because your audience may not know your dad is also a lawyer. So it makes an interesting back and forth, if you will.
So I'll tell you seriously, or on a, I guess, more thoughtful note. This does go back to an incident that my father had with another doctor. And you may have heard this, and we're not going to mention names, But this doctor he was speaking with said, you know what I don't like about lawyers? You lawyers, you're always making a living off of other people's suffering. Now, my father never misses a beat, and he's the kind of guy who always has a response, but he was so baffled that a doctor who, as far as he's concerned, is also making a living off of other people's suffering, just didn't make any sense to him. But seriously, do you see these hats that you're wearing are contributing? We're on the You Are What You Give podcast. Are these both forms of contributing meaningfully to society, or is that you chose one over the other?
I was not happy in medicine, so I was looking for a combination, as I said, and I went into law, and I'm so happy with what I'm doing. In the first place, when people come to me for a potential medical malpractice case, they've already had the suffering at the hand of a doctor, and I'm trying to ease the suffering, whether it's they have a disability now, or their child has a disability, whatever. And so, and I don't wish, I pray regularly. I tell God, listen, I don't want there to be medical malpractice in the world. As long as there are going to be cases, though, you could please send them my way, and I will help ease the suffering of these people. So when they come to me, they've already been through the ringer, and I'm providing a very valuable service, because frankly, with the insurance companies, and it's very, very tough to pursue a medical malpractice case. And so knowing the medicine, since I graduated medical school, does help me on that account. So I'm happy to do it again, and knowledgeable lawyers is what you need in case, unfortunately, when people have been injured. But I will tell you also, easily, most of the cases that come to me, whether it's by phone or email, what have you, I turn away. They're not cases. And I make this very clear. Just because there's a bad outcome, that doesn't mean the physician or the hospital committed medical malpractice. I mean, in fact, doctors can make mistakes all day long. Unless they cause harm, there is no case. And I point that out to people, and just knowing that they're going through life, they won't have a grudge against the physician or hospital is also good. So
that's really interesting. So let's just tap on that one more time. Are you saying that you're going to advise a potential client not to take the case to court because there aren't sufficient grounds of, as you said, the malpractice? How do you distinguish? What do you mean causing harm? In both cases, both outcomes, as you said, the patient has an undesirable outcome. How do you know whether there's a case or not?
Okay, good question. I would think my medical knowledge helps me, and I can obviously do medical research, and I've been doing this many, many years. But for a bad outcome is not enough. So you have to first of all figure out, well, what caused the outcome? And I'll give you a simple example. Say, I don't know, a patient gets an infection after an operation, and they have to stay in the hospital weeks because of that infection. And as a result of the infection, they have some, permanent abdominal issues, what have you. Well, I'll tell you right now, doctors can wear gloves during the operation, can gown up during the operation, obviously scrub their hands before the operation. The nurses, they can clean the OR, completely sanitize it. And no matter what, medical literature will say, I don't know the exact number, but let's say 0.1% of operations will still end up with infection. So if a person has an infection after an operation, that doesn't mean it's the doctor's fault. There's only so much you can sanitize the place, and still there'll be. Now, that doesn't mean, obviously, a doctor cannot scrub, cannot gown out, they don't clean the OR, and then a person has an infection, they tell them, well, in 0.5%, they'll be, no. But the point is, if doctors and all, they do the right thing, and there's nonetheless a bad outcome, that's nobody's fault. That's not negligence. And I tell that to patients all the time, and they have a better understanding of the situation.
And do you find that when people hear that, I mean, is it really comforting? Or were they kind of thinking, I really want to seek some other form of justice?
Well, maybe they wanted some compensation for the pain and suffering, but so far, most of the times people say, I didn't realize that, or so on and so forth, whatever the case may be. we have a very big filtering system, and obviously these cases are very expensive to bring. So there's no such thing as bringing frivolous cases now. That maybe in the old days, if you're like 30 years ago, but you're not going to spend money to bring a case. And you're also not going to give false hope to a patient for this pot of gold and a rainbow when it's nobody's fault. But at the same time, if a doctor or hospital makes a mistake and does cause harm, we're going to go to the mat for the patient to try to get them compensation because that mistake should not have happened. I mean, we're talking about certain basic things, and I always say if doctors are just more thorough or hospitals and nurses more thorough, most of the malpractice would go away. And hopefully, by bringing the suit, it's not only the person will get a compensation, but they'll change their policy procedures and it won't happen to somebody else.
This is really interesting, Zev. The truth is, I want to get to the point where you actually made the decision to electively undergo surgery yourself and contribute, donate a kidney. But just before that, one more point on what you're describing, because I think it's really interesting, the dynamic between the kind of person who wants to be perhaps a beneficiary of some sort of form of justice, and you're directing them in a different direction. This podcast about You Are What You Give is to try to explore primarily the position of the person who's giving, who's contributing. We actually focus less on the person who's receiving. There's room for that, but that's something that we do less. And this idea that you can actually bring people a certain degree of comfort, that they know that perhaps it's not worth their time, effort, and I can only imagine great emotional investment to get involved in a case that who knows what the outcome would possibly be. I mean, how long do these cases normally go on for?
Several years. The wheels of justice grind slowly is it. And so first, we talk to the person, and if it makes the first cut, and many people don't, we get the medical records, the keys in the medical records. And then, of course, just because I think it's a case, most time I'm right, but sometimes not, you have to send the case out to medical experts. They have to be the one. And then you have to file the lawsuit. And the defense likes to drag things out because, frankly, if there's going to be money going to your client, it's going to get interest in the insurance company's bank account before it comes to your client's account. So they like to drag things out. So cases go on for years. I have a case going in March in Kentucky. It's been going around for 4 years. So it's a dynamic. We'd like to speed things up, but sometimes, including COVID, that puts a damper on it. But we're doing the best we can.
Well, thank you, Zev. And before we turn to the kidney, I want to ask that one more question about the rabbinic role that you play. Again, this concept of giving. On the one hand, you spent your time, again, committed yourself to getting rabbinic ordination. On the other hand, as you said, you don't have a community per se. You don't have a pulpit. Is there still something about being in rabbinics, being a student of Torah study, that is in a way contributing or giving to society?
I'm sure there is, and I have certain role models that do that. But honestly, that's not why I did it. I specifically went into it because my dad was a rabbi, and I wanted to give him some pleasure having his son being a rabbi too. And when I told him I graduated the program, he laughed a bit. So that was, I went through frankly educational reasons, and I'm always constantly learning, and this was just another avenue to learn Torah, the Bible.
It's a personal development thing. I'm again sorry, Zev. When we speak, I'm always reminded of another joke. This time, I'm reminded of the joke of the woman who's approached her son as the first Jewish president of the United States, and people say to her, "Wow, it's amazing. We heard that your son became president." She said, "Oh, but you should see my other son. He's a doctor." So. It's the Jewish mom who wants the doctor or the lawyer as a son, and you got both. And now, also, of course, for your father being a rabbi. So I think you've checked off quite a number of boxes. I want to talk now about some other boxes that you've been able to check off. And before jumping again into that kidney, I want to get a sense, perhaps you could share with the folks here, of your philanthropy in general, without maybe specifics, maybe a given project, maybe yes, maybe not. What have you traditionally liked to give to when you give your maaser, your tithe, or any other kind of giving? What do you traditionally like to give to?
It's usually two things. One is Torah, specifically yeshivas, kollels, academies who are learning Torah, different subjects in the Torah, but people who just learning Torah. As you know, it's not necessarily the most popular thing to give today, that's for sure. And I'm very wary of people who have generally large families, lots of kids, and the wife is working, and the husband is dedicating himself to learning Torah, and this is not a big income thing. It's a lifestyle choice, and so I'd like to help out those. And the other thing, of course, is uh, poor people, who not only don't have money for food. And I remember one time didn't have a refrigerator. I mean, we are in a very wealthy society compared to hundreds or thousands of years ago. Very wealthy society, and I just think I grew up middle class, but I mean the apartments we live in, the houses we live in, the bounty of food we have, the cars, the vacations. It's just an amazing wealthy society. And there are a lot of people who do not meet that, who have trouble putting food on the table and buying clothes for their kids. And that, so I feel it's important to share the wealth. I guess that's the way to put it.
Well, that's outstanding, Zev. And I kind of want to look at those two different models for a moment. You're talking about supporting Torah study, and in that model, you mentioned also the family dynamics, right? There's a person who has dedicated himself to Torah study. That's, of course, a dedication of the entire family. That family structure stays together because his spouse, his wife, has chosen to support the rest of the family economically. But still, there are stipends available for people who study Torah because people such as yourself value the fact that the Torah is being studied. But do you also see that similar to the kind of families in the second bucket that you described, the people who are needy of means? Is it that when you're supporting the Torah study, is it the study that you're supporting? Is it the family so that they have enough means? Or do you see those as kind of two sides to the same coin?
Yeah, I think it's together. I think it's together. I mean, once there's someone who's dedicated their life to Torah study, I mean, obviously, and they're very limited means, and there's constantly attacks on the kind of money they can bring in and support they can bring in. It's beneficial to give that family money, and it allows the family to function as a family. I mean, financial pressure is a very big pressure and causes a lot of mental health issues, what have you. And so if you can alleviate that financial pressure just a little bit, I think it helps the family dynamics. And also, yes, you have a part, I believe, in the Torah study, the famous partnership of Yisachar and Zvulun. Zvulun would go out in the ships and trade, if you will, and Yisachar would stay home and learn the Torah, and they had to share in each other's activity.
Right, the two of the 12 tribes, brothers, who those two tribes would be in that kind of constant partnership and allow both of these things to happen, both financial means and spiritual depth that would be both contributors to the Jewish people and the Jewish future. So thank you for that, Zev. And I want to, with this, move to the kidney issue, right? This week, as we record, this is a pre-recorded episode, but this week, the Guinness Book of World Records came to Israel. There was a gathering of some 1,000 people who have donated kidneys. Indeed, Israel has passed, I guess this is per capita, I don't know the stats exactly, but certainly per capita, the leading country of kidney donations, elective kidney donations.
In the world.
In the world, correct. The leading country in the world. And with more than 2,000 donations over the last several years. And again, certainly per capita that exceeds other, perhaps even in absolute numbers, that exceeds other countries as well, that I don't know. And so, Zev, you're one of those people. If I understand, you're one of the first. So my first question to you is, what brings a person with perhaps the kind of background that you have in medicine and your other hats that you wear, what brings someone such as yourself to move from donating funds to donating a kidney?
I would donate, first of all, I think it's about 12 years ago. And honestly, I don't even think about it unless people like you ask me about it. It's just like out of sight, out of mind. I still maintain a friendship with the recipient of my kidney. I don't
Really?
recall if I read an article or something like that, but it really sounded interesting. 12 years ago, I'll tell you, yes, the Guinness Book of World Records just happened over 1,000. I was 12 years ago, number 71 or 72. So
Wow.
it's just exploded exponentially since then, exponentially. And I read about it more and inquired about it. And I realized it's not like in the old days, there's really very little, if any, risk at all to it. And so, I mean, there's a famous saying, "Zen nana v'zelo chaser," which translates, in this case, when you donate a kidney, this guy is benefiting and the other guy's not losing. And that's what I feel. People don't realize you can live fine on one kidney. And I do live fine on one kidney. And the joke is that's why God gave us two kidneys, one for us and one to donate. And
And
so,
I wonder if that's a joke, Zev. Maybe it's for real. I live in a neighborhood, Zev, where a lot of those 2,000 plus donors live. It's the joke here in Ariel is that it's embarrassing to walk around with two kidneys. It's like, who has two kidneys? If you've got two, you got to give one away, right?
it
And
makes sense. And every donor said, if I had three, I'd give two away. I mean,
right.
it affects, I was the poster boy. I mean, they made me stay in the hospital overnight. I didn't want to, but I left the next day. I went to work right afterwards. Now, I couldn't go to the gym again. I go to the gym every day, and they wouldn't let me do that for, I think it was like a week or 10 days. And I was just walking the neighborhoods, and everyone would see me in the neighborhood. Well, oh, you're walking, you're not at the gym, and it's not a big deal. But after that, the only thing I will say that I do remember I wasn't happy with is like a lady who delivers a baby with a C-section. Every time I coughed or laughed, I had to grab my belly so it would not hurt when I'd cough or laugh. But other than that, completely fine. No effect of my day-to-day activity. And the only thing is, I'm not a big pain medication, but you can't take non-steroidals. So, for example, if I had a headache, whatever, I'll take a Tylenol. You can't take non-steroidal. Now, you can take one or two pills. You're not going to die on the spot, but you can't continue to take non-steroidals because non-steroidals are metabolized in the kidney. But Tylenol is not, and all the rest of the medications are completely fine. And so I really don't think about it unless, let's say, I get contacted by the recipient several times a year because she was a diabetic nurse, a teaching nurse, and this changed her life. I mean, she was on the transplant list, and it's just amazing what you can do. And I'm not saying I had the whole part of it, but since I donated, three other people in my synagogue donated. And so, when you see someone donates and it's completely normal, and you save one life, you save the world, it's like, whoa, why not?
Zev, I want to talk about the domino effect, but first I want to get back to the recipient. And let's not mention names, of course, but you mentioned she herself was a nurse. It's so fascinating to me. Someone who dedicates her life. I mean, if there's a selfless profession, we talked before about professions that give. If there's a selfless profession, and I've worked in hospitals before, it's nursing. I mean, that is all give and very little thanks. Perhaps that's just an unfortunate situation, but these people dedicate their lives to giving, and then they're on the receiving end. I can only imagine how difficult that is. What was that like to meet the recipient for the first time?
It was very emotional. And first of all, I told them they should not have done it like that. You'd have to do different checks, what have you. And I went there that day, remember, and doing the check, and she and her husband were like at the table. And it was very quickly, I realized who then they very quickly was. And I said, what's going on? I told them after, you should not, what pressure? Maybe our blood would not have matched or something like that. And they say, no. Today, with the rejection drugs, whatever, it's like almost never a problem to find a donor. And I mean, we have 4 blood types. There are many little minor things after that. But if the major blood types match, you're almost assured good to go. And so I mean, she got very emotional because here, this, like, it turned her life around.
Of course it did. Dialysis, et cetera, et cetera. But first of all, if I'm not mistaken, you were number 71 or 72 out of, I think it's now 2030 something, from what I checked the other day, and it's probably a few more since then. But of course it's emotional. Was it emotional for you also, Zev?
It was. It was. I'm just tearing up now, actually, think about it, because, when we have maintained a relationship, and actually, twice a year, she'll send me a big fruit basket or a candy bar or a plant. And I said, no. And she says, you can't. She refuses to listen to me. She refuses me. She says, I'm her brother now. And I have to listen to my older sister. And so I'm sort of stuck in this. Very sweet. We've met several times over the years. Her husband's lovely. Me and my wife and her, we get together. And it's just, she's a lovely person, and I was so happy, and she's happy, and she has now grandchildren she spends time with. Yeah, it's really nice, and I have heard similar things with other donors and their recipients, and you make a bond for life. It's just amazing.
It is amazing, and I think it's something that you downplayed a little bit. Sure, I was in the office the next day, et cetera, et cetera. I know some people who didn't recover as quickly as you do. And I guess that's just a personal disposition, maybe the medical care that you got, maybe the fact that they knew that you're a malpractice attorney, they gave you extra special care, Zev, who knows, right?
I was told, because I went to the gym every day, that I was a good specimen, if you will, and had really medical issues before then. And so whatever it was, thank God it worked out.
I do know, I understand that for women, they're not supposed to have children after donating a kidney.
Is that
And I know
true?
someone who
I
did,
had not heard
I
that.
believe so. I know someone who did that, and she made what she considered a difficult but important decision. She felt so compelled to give a kidney to someone else. She already has a number of children, and decided that this was the right thing for her to do at that time. And that actually leads me to a question that I have for you, Zev. And this is quick disclaimer: none of what I'm going to ask you for, Zev, is official medical advice, or legal advice, or rabbinic advice. It's kind of a little bit of everything of who you are, and just maybe give me some insight on how to approach the following challenge. So just, I mentioned that there's this Guinness Book of World Record that just, Israel topped the charts. And at the same time, there's someone else in my neighborhood who's in need of a kidney. And so, of course, I feel compelled to go through the process of seeing if I'm a match. But at the same time, there's a blood relative of mine who is, I'm not in need of a kidney at all, any way, shape, or form, but we've been told, they have what's called a pelvic kidney, which is a certain condition, and we kind of wonder, maybe, who knows, one day, what if they were to need something? What kind of position should I put myself in? Should I go ahead and the first opportunity of someone in my neighborhood who needs a kidney, run ahead and see if I'm a match, or kind of hold on to that kidney? Sure, you have two. You don't need them for the entirety of your lifetime, but maybe you'll need it for someone else along the way. How would you suggest that I approach that?
Good question. That question has been asked many, many times, and even during my interview process, they brought that up. And so, first of all, statistically, you'll never need two kidneys. Statistically, only if you have, let's say, a kidney disease that affects both your kidneys will be an issue. But other than that, unless someone shoots an arrow or shoots a gun into one of your kidneys, you will never need a second kidney for yourself. For another relative, obviously it's possible, statistically, they will never, ever, whether it's pelvic kidney or not, need another kidney. And having said that, in the rare circumstance that maybe someone in your family needs a kidney to donate, what have you, if you've donated a kidney, your relative goes to the top of the list, the top of the pile. And as I said, when you're on the top of the pile, there's only 4 blood. There's a match right away. There is no hesitation. So I've heard this, save 2 kidneys for a rainy day. The rainy day really, really statistically will never happen. But if heaven forbid it does, and you have a family member that is either that family member goes to the top of the list. I'm 100% positive. Now, having said that, I would say go and get involved. I mean, it's a good deed. It's a mitzvah. And I have told your dad several times that I've put him on the list, and I've told them when they go to his house and say, hey, we're here to pick you up to donate a kidney, I said, listen, your dad's a kidder. They'll say, no, 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 I didn't. I tell them, don't listen to him. Really, he wants to donate a kidney, and tie him up and take him to the hospital despite his prostration. But putting that joke aside, it's just the thing to do. It just seems like you just excellent. And everyone sees everyone else is just continuing on their regular life. And so it's not a problem. Obviously, thousands of people have realized that I don't need to save it for the rainy day that's not going to happen. But again, if heaven forbid it does, your relative or what have you, I'll do it even further. I remember specifically, forget a relative. Let's say you want to donate a kidney to a friend or whatever, or I did it to anonymous. I know the person now. I didn't know at that time. I donated to anonymous. And no, heaven forbid, something happens and I need my other kidney, someone shot an arrow with or what have you, I go to the top of the list.
Right.
So it's not going to be an issue. Avi, I'm going to hand your name in tomorrow, and they're going to start the process.
I will tell you, Zev, that the two things that happened yesterday, one, I reached out to you about this interview. Two, I did send to that friend of mine just a request to go through the process of checking it out if we're a match. So who knows? I guess it starts with blood type, and we'll take it from there. But yes, definitely exploring that. Thank you, Zev, and thank you for the encouragement. I think a lot of what you said, though, is there are some pragmatic elements to it. And I want to, before we close, get to maybe the perhaps a deeper appreciation for what it is that we do when we're giving, when we're making these contributions. Again, you seem to be very nonchalant about, I gave a kidney and went to work the next day and walking around instead of the gym, but within a week and a half you were back in the gym. But there is still a certain degree of sacrifice. You do have to go out of your comfort zone to give a kidney. And there's that element also of there's someone in front of you right now, maybe it's a neighbor or a friend, who needs to be saved right now. And if there's something that you can do, of course you want to do. What does that mean to you? Or perhaps in a broader sense, this term that we use, you are what you give. What does that say to you? And by the way, I'm not suggesting with you are what you give. This is one of the interesting, I guess, incidents where we would say, you are not the kidney that you gave away, right? That's not what we mean when we say you are what you give. You are what you give as opposed to you are what you eat. We are not about what we consume. We are about what we contribute.
Yeah, it's an interesting thing. I will tell you, I'm reminded of my favorite movie in all life is It's a Wonderful Life with Jimmy Stewart. It's an oldie, but a goodie. And in the office of the dad, Jimmy Stewart's dad, Mr. Bailey, there's a sign on the wall. And you can get that, and it says, you only take with you what you give away. And that's how it is. This is, we're here to do good deeds. This was an important good deed. And yes, it was a hassle. I had to do the scans, check my heart, and make sure I'm giving a healthy kidney, which I did give a healthy kidney. Obviously, if you're not a healthy person, you're not going to be able to give a kidney. Okay, fine. But once that's done, it's a good feeling. Again, I'm not reminding about it day to day. I'm only reminded about it if someone does an article or someone does the Guinness record, whatever, or that my recipient contacts me a couple times a year, what have you. But other than that, there's just, people say, hey, what's your next project? What are you going to do next? So always looking for things to give, to do, to help improve the world. And it, in my little step, I can't, as they say, I don't remember his name, the famous rabbi, I can't change the world, I can't change the country, I can't change my town, but I can change myself and do a little good in myself, and maybe that'll have the butterfly effect and create good around the world.
Wow. So, Rabbi Dr. Zev Gershon Esquire, I love everything you've just said there. I don't know if you know this, But if I'm not mistaken, my father's favorite movie is also It's a Wonderful Life. Have you spoken with him about that?
I don't remember if that's his favorite all-time movie. I'm sure over the time we have spoken about it.
I think it is. I think it is. It's like on the top of the recommendation list for getting the grandkids to watch something in black and white. Yeah, we try to do that indeed. And yes, that you're only what you've given away is 100% at the core of what we're speaking about. And so I guess the very final question here, because you just mentioned, what's your next project? I do believe that people can give better. And giving better doesn't mean giving more. It means perhaps giving more meaningfully, more mindfully, or more measurably. There's those kind of mores, but it's a qualitative, not necessarily a quantitative thing. What is your next project, Zev?
I don't have something particular in mind. I recently, actually, we dedicated a synagogue in Ashkelon in memory of my mom, who passed away a year ago. And
Yes, yeah.
next time you're there, you'll have to go visit that synagogue. You'll see the dedications for my mom. So other than that, I'm trying to find. I have actually learning Torah with someone online, because again, just like you can give money, you can also, someone who knows a little Torah can share Torah with someone else on the receiving end. So that's another avenue I'm doing.
Well, you're always looking for the next thing. And by the way, I didn't know that about the synagogue in Ashkelon. I think that's outstanding. I remember your mother well, of blessed memory. And so that really is a blessing. And so just, I guess, Zev, keep at it. Keep up the good work. It's amazing to see how you've followed this, I don't know, followed, led, but been involved in this set of life experiences that has set you on a track of being able to contribute in so many ways to society. And I think there's a lot to learn from here. So thank you very much for your time and for enriching our community with your giving, Zev.
Thank you.
Before we close, I want to leave you with a question that sits at the center of this conversation. What is your second kidney? Not what could you give that would hurt the most, not what would make you look heroic, but what do you already have that could change someone else's life without taking away what you truly need? Because one of Zev's most powerful ideas is this: giving can be powerful even when your sacrifice is small. So here's the weekly giving challenge. Give without losing. This week, identify one thing you can offer that creates real benefit for someone else while still leaving you whole. It could be a connection that opens a door, a skill you can share, time you may have at your disposal, encouragement that strengthens someone, a resource you already have access to, or perhaps taking the step that Zev Gershon has taken and exploring the possibility of donating a kidney. Thanks for listening. If this conversation resonates, please subscribe. It's a simple step that helps us share the word and build a community that values what we give more than what we take.